Well, hello, everybody. We are gathered for what will be a very good 90 minutes or less, depending on what we do together, where we're going to focus on funding and how to get funding and who to get it from and how to think about funding. So all the who, what, where, and when of funding, which is exactly what you read in the program and hopefully what you want to hear about today. We're going to spend a little time looking around the room and understanding, for our sake, who you are. So the first thing that we want to talk about, and by the way, my name is Cohen. I'm with AARP Massachusetts. I'm the manager for outreach and volunteer engagement. I've been at AARP for 20 years. And Rebecca, to my left, has been at the funding game for how many years?
About 10 years. And I will say I was in a nonprofit writing grants for about 7 or 8 years before that.
And I'm Caroline Murphy with the Community Foundation for Metrowest, and I am in the exact same boat, 9 years at the foundation, and about 10 years prior to that writing grants and doing development work for nonprofits.
Now, you might think we're a bit Metrowest-centric here, but what they talk about is going to apply to wherever you are in the state, okay? My office is statewide. We're here to serve every corner, nook and cranny of the state. And so one of the things that we want to hear first from you about is what are your interests and why you're here. So this is not going to be something that we'll be able to hear on the video because the microphone is what's giving the sound over to James over there. But the point is that it's our opportunity to get to know you a little bit. So if you could just say, what brought you here? Why did you choose to spend another 90 minutes inside when you can be outside in this beautiful day? You can do whatever you want to do.
Get age-friendly communities implemented in a lot of our housing production plans and master plans. So I'm just curious to understand how you kind of intertwine, planning, policy, age-friendly communities, and outreach to communities so they can understand why they implement their plans in order to get them passed with their plans and master plans.
Beautiful. Needed for everything that you've just spoken about, so you're in the right place. Terrific. Liz Miska, why are you here?
Stand up. I think I can stand up. I am here because Kara brought me here. Literally. And for those of you that can see, which I think is everybody, I'm wearing a badge that says VIP, not for a very important person, but for a visually impaired person. So I was a sighted person for the majority of my life, and actually I am featured, thanks to James, in one of the podcasts, the Moving Forward. So I'm expecting all of you to tune in and listen to that. So I'm an advocate and an activist, an adventurer, and I in coordination with a person on wheels and a technologist, have just formed a nonprofit. That has to do with accessibility. So, as has been said all morning, you make things accessible for a certain segment of the population, in this case seniors, you make it accessible for everyone. So that's what I'm looking for, funding for other adventures. So thank you.
Excellent. Thank you. And behind Liz?
I'm from the Central Massachusetts Regional Planning Commission. Just like Amber, we work with 40 communities in the southern Worcester County. And our mission is to help our communities the best way that we can, with anything that we can. Right now, we finished about a year ago regional age-friendly and dementia-friendly for our region. And now we're in the process of implementing that, and funding is a key aspect of it.
Excellent. Glad you're here. Patty Sullivan. Does anybody need to know why Patty Sullivan is here?
I'm here for a lot of reasons. But I think it's important to note that like many people, I live on soft funding. I have for most of my career. having to raise money to support the work that I do, except when I worked for the United States Congress, and then you paid my salary. So, I spend time in communities helping them figure out how to raise money, and have been working with regional planners, with helping individual towns write engine dementia into their master plans, you know, all of the things that have to be done. My area of expertise in this particular realm is spending other people's money, and I hope we'll talk a little bit about that.
Thank you so much. Next, over here, yes.
Connor Robichaud, also from the Central Mass Regional Planning Commission. So we're trying to implement our age-friendly plan. I think a focus on sustainable sources of funding would be of interest to me. A lot of the things we outlined could be done with sort of a one-time injection, but keeping it going over time is always the thing towns are interested in.
Perfect, thanks.
Hi.
Hello.
My name is Sharon. I work at Tri-Valley in Dudley, one of the ASAPs, Aging Service Access Points in Massachusetts. And I am here to get information to support any of our towns that are starting to become age-friendly, point them in the right direction, give them the good information. We did have one of our towns recently. I don't know if anybody in here is from Charlton. Oh, perfect. Charlton has a lot to say. Lots of changes recently. So to get the information and to pass it on and to support people.
Excellent.
And I'm Kathy Murphy from Charlton, and I'm here because I joined the Dementia Friendly Charlton. I'm not professionally involved with the elder population. I actually am a retired teacher of middle school, but I have two sisters that work with the elderly population in Worcester, and both in Worcester, and they encouraged me to spend some retirement time. So I decided to join, and I'm here because I signed up for a needed committee on raising money and fundraising and grants. So I'm here to find out more about that.
Perfect, thanks.
Hi everyone, I'm Liz Trediak. I am the Director of Elder and Human Services for the town of Littleton. Also a caregiver of somebody with dementia. Our town, Littleton, is AARP age-friendly designated officially, but we are not officially dementia-friendly.
Yet.
I have my checklist right here. I feel like we are doing all these things.
You are.
I have great buy-in from all leadership, from police chief to town administrator. We just haven't made it official. So I'm here to learn about funding and how to advance us forward.
Thanks.
I'm Jeff Walton. I'm a healthcare executive, mostly working with physicians and health systems who are interested in providing dementia services in general, or have geriatric services. And particularly what I'm focused on is finding groups who are interested in participating in a sustainable funding source that Medicare is going to be coming out with called GUIDE next year. It's the Dementia Care Coordination Program that Medicare will be launching next July. And it connects community resources to physician and nurse practitioners who are the point person, the primary physician or care provider for that individual, and then gives the funding to them to flow through to community-based services. And it's a significant amount of money. It's about $6,000 a year for someone for care coordination and support services. And there's going to be one application period coming up this winter. Medicare hasn't released the final rules. The general rules are there. And so I'm here, A, talking to people who are interested in that, and B, wanting to get network with folks who are interested. It's going to be a tight time frame for the application. It'll be one application. Program will go on for 8 years, but there's only going to be, at this point, one entry period. So that's why.
Thank you for sharing all that.
Yeah.
I'm Karen Phillips. I'm the director of the Holden Senior Center, and our town is just starting this process. So any information I can bring back to try to win them over, I figure is a good thing.
100%. Yep.
I'm Taryn Hermano. I'm the Health and Wellness Coordinator for the town of Weymouth. So we have been a mass in motion town working on healthy eating and active living for the last 13 years or so. So we are not age and dementia friendly, and it's something that feels very timely and the right timing and the right thing in the next step. We have a very large aging population that mostly are aging in place. So yeah, you're learning more about, especially municipal government. The first question always is the funding, and especially the sustainable funding. So.
Okay, good. We're all in the right place for the right reasons. And we are going to spend about 5 to 10 minutes hearing from Rebecca, and then 5 to 10 minutes hearing from Caroline. And then we'll spend some time learning about some sources that I can share with you about. Then we're going to do some neighbor-to-neighbor talking so that we have some interaction and probably spend a good chunk of time in the session on that if you're comfortable with some sharing back as well so that we can have some good interaction. So if you're ready to kick it off, Rebecca?
Hi everybody, and thank you all so much for sharing kind of why you're in the room, and it's great to see you all here. And I want to at some point get back to that sort of this theme about funding, municipalities looking for sustainable funding, because it's interesting, foundations actually look to municipalities as the sustainable funder. So I think that's a great point of discussion as to where that disconnect might be. All right, but before we get into that, I will start with just telling you a little bit about the foundation. So I work at the Metrowest Health Foundation. You can kind of see the map here. We are a health conversion foundation. Anyone know what that is? Besides Patty and James? All right, so what that is it means we were created about 25 years ago by the sale of 2 hospitals. So Framingham Union Hospital in Framingham, Lenamore's Hospital in Natick, sold from a nonprofit hospital chain to a for-profit hospital chain. When that happens, the Attorney General gets involved. All the money has to go to a corresponding charitable asset, which became our endowment. So at this point, we have about a $100 million endowment. So we put about $5 million into the community every year for various public health programs. And we define health, I have it here, very broadly. So really all those domains in the age and dementia friendly, we're defining health as sort of all that, all the social determinants. Beyond funding, we do a lot of data. If you go to our website, there's an adolescent health survey that we do for every middle and high school youth in the 25 towns we serve. We have multiple economic data reports. We have a housing report. We just did a community needs assessment that's up there, so lots of sort of data sharing, and then also convening and training. Questions about the foundation? Good, all right. So I just want to talk briefly kind of about framing healthy aging and kind of age-friendly work in terms of funding. So we're all aging all the time. We all know this, right? So in that sense, I would almost think about it in 2 ways. Funders that prioritize healthy aging, I think also prioritize all this other stuff. So if you're talking about healthy aging, you're talking about food, you're talking about housing, you're talking about access to healthcare, you're talking about social isolation. And I think on the other side, funders that are funding food and housing security and transportation and all this stuff also should be funding that with older adults. So as you're thinking about funding sources, don't just limit it to folks who say we fund older adults. And again, I think that's pretty amorphous. Like nothing magic happens at 65 or at 50. All right, so I'm just going to talk about 2 quick examples of programs that the foundation has funded, and then I will pass it on to Caroline. So the first is a Daybreak program from the Hudson Council on Aging. So this was one we funded actually before COVID. There was a pause, and then we kind of picked it back up again. It's an extended day program for older adults with cognitive impairments in 3 different towns. So really the issue this was getting at, which everyone in this room knows this is an issue, is that if you have someone with a cognitive impairment at home, there's a family caregiver, they need respite, there's sort of 2 options. There's family that can come help, which not everybody has, or you pay a ton of money for respite. So what the senior center did was they said, okay, can we create a really affordable option? I think it was $50 a day, and if you can't pay, then you didn't pay, for 3 hours a day at each of the 3 centers. So someone could actually go 3 times a week to each of the centers for 3 hours a day. So it gave stimulating activities to the folks with cognitive impairment, and then the caregivers could go and do whatever they needed to do for those 3 hours. So some outcomes, so 80% of caregivers reported decrease in stress, not surprising, and they had 73 folks participate. And it stopped during COVID. They did try to do some work around like doing it remotely. It did not work. So as a funder, we just sort of said, hold the money, wait. At that point, actually, COVID had just hit, so we said, just wait a few weeks. It'll be great. You can just re-up this in like a month. 2.5 years later, they're just getting it back up and going. But it's actually needed even more because folks had then been isolated for a year, 2 years plus. Yes. Great, thank you. All right. Any other questions about this program or this one? Oh, that's a great question. It is public. Did you want to repeat the question? Oh, I'm sorry. So how much was the grant for? It was a 3-year grant. I want to say it was $25 a year, but I could be wrong. I don't actually remember. I'm sorry. That should have been on the slide. But I can definitely get back to folks. It's an easy look up. So this one's actually a new grant, and this program I think is really interesting, and it may be happening in other parts of the state. But Jewish Family Service in Metrowest, it's a home share pilot program in partnership with the Framingham Council on Aging. And every time I talk to the executive director, I have the Golden Girls song going through my head. So now you all do too. You're welcome. But really, this is in response to the housing crisis that certainly is in Metrowest. I know it's across the state. We're not unique in that. But really the idea that there's older adults who may be living alone in a big house. They may want to sell their house, they may not, but even if they do want to sell their house, there's nowhere to move to because all the rental prices are ridiculous. I think the median rent in Framingham is something like $3,000, which is insane. And then there's folks who are renting whose rent is going up and they're having trouble affording their rent. So really the idea is to pair those two folks. So having older adults looking to rent a room or part of the house with folks who have a house. That sounds lovely. We know that this is not an easy thing to do. Obviously, it takes some work. So part of the funding went to the caseworkers at Jewish Family Service to really help facilitate the match, but also facilitate the ongoing kind of relationship and troubleshoot anything that they need help with. They contracted out with Nesterly, which some of you probably know, to really handle the logistics. So money doesn't change hands between the two folks living together. It goes through them. All the legal stuff was handled by them, so that was sort of all over here taken care of. So again, we just made this grant, so it's really a pilot program. I think there's huge potential impact certainly on housing security, financial security, but also I think around social isolation. You have two folks living alone who, again, if it works out, that could be a really great thing. All right, questions about that one? Yeah. I think more the second one, which is where actually the Council on Aging comes in. So they know a lot of folks. So it's definitely not random or not like, hey, someone put a dating profile up, see if you like them. Although that being said, people are people and there's variables, and you've lived alone for 50 years. All of us would have a hard time then getting a roommate. Anything else? Yeah. That is a great question. I don't know at the moment. They were just ramping it up, so I'm not sure. Stay tuned. But the contact at Jewish Family Service is Lino Covarrubias, the CEO, so I'm sure he'd be happy. He loves talking about this program. So if you reach out to him, he'll talk to you forever.
For right reasons. Yeah. For the right reasons.
All right, so I had some slides on grants, but I'm actually going to give it to Caroline first.
Great. So I'm Caroline Murphy. I'm the Director of Programs and Donor Services at the Community Foundation for Metrowest. So I know we're both Metrowest foundations. We both identify Metrowest a little bit differently, always a joy to this challenge, but 95% of our communities overlap. And so really sandwiched between 95 and 495. And we're a community foundation. So for those who aren't familiar, community foundations, there are actually 16 here in the state of Massachusetts, and about 700 across the country. It's a great movement that is really place-based grant making and resource forming to support a specific geographic region. We serve, as I said, 33 cities and towns, so a wide variety of communities. And we also, in addition to grants and capacity building work and professional development and training for our nonprofits, we also hold funds at the foundation, and we can talk a little bit about that in terms of fundraising and funding initiatives too. But there are a lot of individuals and families or corporations in the communities across the state who have set up charitable giving funds, who might be interested in the work that you're doing. And so it's just another vehicle to talk about as a funding stream and opportunity. Especially a lot of fund holders, at least that we work with at the foundation, are really focused and interested in pilot programs. So really taking those risks and helping people take those risks to prove something. So what are those proof models that you all can think about in terms of age-friendly, dementia-friendly communities that individual funders or foundations can support for long-term sustainability through a municipality or a larger funder? Our priority focus areas at the Community Foundation range. So they're all listed here on the screen: arts and culture, environment, human services, hunger relief, equity and education, workforce development, and youth development. And what we really say in terms of, how this focuses on older adults and age-friendly and healthy aging is that really is intertwined into everything we do. So we support a lot of youth-serving nonprofits who are looking at intergenerational opportunities and how can those relationships exist in really healthy ways and support youth development and enrichment. So it really is kind of across the broad scope of our work. Even our equity and education work is engaged. Actually, one of our great partners, Literations, works with AARP to find volunteers, so older adult volunteers who become mentors to young people in the schools and help them work on their literacy skills. So again, it just really kind of ranges in how we look at healthy aging and engaging older adults in the work that we do. We can talk about this. We're going to get to grants in particular, so I'll talk about this slide a little bit more too in the kind of framework that Rebecca has set up. But we ask a variety of questions in terms of our grants too, and I think those are really helpful kind of categories, which Rebecca also has some great information on, like how to think about your storytelling, how to think about preparing for writing a grant or asking for funding, kind of those key buckets of information to be preparing on your end. But I'll skip to some great examples as well in terms of projects and initiatives that we've supported. So one is the Westwood Council on Aging. Our friends at the Westwood Council on Aging came to us and applied through a hunger relief grant program 3 years ago. It was a grant for $11,000, so nothing huge, I would say. And the funding need was to purchase discounted CSA shares from a local nonprofit farm. And what they were doing was, it was an interesting conversation. If anyone knows Lena there, she's fantastic. But a real interesting conversation with her was around why couldn't you provide vouchers to older adults to go and get their own share? Is that an opportunity for them to get out into the community, to explore the farm that had other programming available? Or could they have the shares come here and just not have to repackage? What was the purpose of the cost in addition to the discounted shares? We were also paying, she was requesting some staff time. Again, not a punitive question. We were just really curious kind of what the model was. And as we dug into it, what she really wanted to do and what she felt was necessary in order to create access to that healthy food and that local food was to take the CSA shares and break them down into appropriate amounts of food for an individual older adult living alone, or for a couple, who had dietary restrictions. So really being cognitive of the relationships she held with the people who were utilizing the services at the senior center and the Council on Aging, to really customize those packages and utilize a local partnership with a nonprofit to do that, because the nonprofit couldn't or wasn't. And so how could she be that intermediary to really serve her clients the best way she could? So, I think there are a few things to highlight here. Obviously, addressing food insecurity. It's a big concern with older adults in healthy aging, is making sure that on fixed incomes, they can get the right food that's appropriate for them, or gain access to produce, which is very expensive. Addressing equity and access challenges. So again, that farm wasn't able to maybe produce a really specific share structure that made sense for an individual older adult living alone. But the Council on Aging could really customize that. Leveraging local collaboration. So that's a lot of what we talk about. And the next example is a perfect example of that too. And then a creative and complementary approach beyond traditional food support. So we all know of Meals on Wheels. We know that food pantries are available, and community meal programs are available. Those are great, but this is just another angle of really customizing and having another option available for older adults in the community, which we thought was really great. The other example up here is with Minuteman Senior Services. And so it's interesting, I'm talking about them in terms of their work. They applied for a human services grant. It was a $15,000 grant, and it was actually a general operating grant. So to cover their general operating needs for the work being done in Metrowest. One of the specific things, though, that they do is underwriting programs like Meals on Wheels, Elder Protective Services, the Shine volunteers that they have going into COAs, excuse me, and so much more to support their COAs. They work with 19 different COAs. And so I think one of the key things with this one in particular is just recognizing that a town agency or a planning organization doesn't necessarily need to do the work on their own. They can find a nonprofit partner who really wants to collaborate to do this work and has the resources to write the grant, to do some of the work, reporting, et cetera, evaluation. But really leveraging that partnership was really important. I'm going to pass it back to you for the grant piece, and we can bounce back.
So you've heard a couple of examples. Now you have an idea, or you have a program that's already running. You would like to approach a funder. And before I go into this, I will say, at least community foundations and a local foundation like us, talk to us first. I swear we'll answer the phone. I'll talk to anybody. The answer might be no, but I'll talk to you. So it's always worth building that relationship and also getting to know the funder. I mentioned we do a lot of convenings and trainings and have data. If you really think, our foundation or a different foundation in your area is a good fit, go to their stuff, meet the staff. That does make a difference. That being said, before you approach the funder about a specific program, if you can answer generally these 5 questions, you'll be in really good shape as you're talking to them. So what will change if your program is successful? So it's a wild success, everything went great, what's different? Why do it? Who will it change for? And I would say, and I'll get into this in a minute, but be really specific about that. And this one really gets to equity. If there's a health disparity, if you're doing a diabetes prevention program in a community and you're not talking about disparities between African American and Hispanic folks and white folks, we're not going to fund your grant, I'm going to be honest with you, because you're not actually looking really at who this is impacting the most. Then what will you do? This sounds really obvious. I will say I have read beautifully written grants, probably by grant writers, where there's data, there's a need, it's eloquent, it's like a great term paper. I get to the end and I have absolutely no idea what they're going to do. Those also don't get funded, no matter how eloquent they are. And how will you know if you're successful? So really this is just how will you measure it, how do you know? And I'll get into that in a little bit. That doesn't have to be a double-blind study. It can be really basic. Then who else in the community is doing similar work? So Caroline mentioned collaboration. So this is one, especially local foundations and community foundations, we know, I won't say everybody. We know a lot of folks. I mean, we serve 25 towns. We know a lot of what's going on in the community. So if you're pitching us a program that I know someone else is doing the exact same thing, and you haven't talked to them and you don't even know they're doing it, I'm probably going to say you should probably talk to them first. Doesn't mean two people can't be doing the same thing. There's a huge need. This is not a competition, but you should sort of know what's happening around you. Questions about that? All right. So I'm going to actually go through, quickly just kind of a few questions to think about as you're writing a grant proposal. And Kara and Caroline, feel free to, or anybody really, but you two feel free to jump in. And this is stuff that's in our proposal, but really these categories are in pretty much every grant proposal. So the first is the need. So why does this issue matter in your community? Not nationally, not in Boston if you're in Worcester, but like in your community. Why is this an issue? So why is housing security an issue in Framingham? And why are you the one to address it? So there's a lot of issues out there, a lot of things we could address. You know, if your agency works on housing and you're proposing something around food security, you really got to think about like why are we doing this? Or on the other hand, if you're a food security agency, that's clearly logical if you're talking about food security. So really think about why you're the one. And also think about your relationships in the community. You might be the one because you know all the players in the community. How do you know there's a need? So that could be certainly data. Like I said, we have some local data on our website. Community Foundation, I'm sure Caroline will talk about, has a lot of great data on their website. Other community foundations also have some great data. And also, you know, going to the last one, what are folks you're serving telling you? So not just what does the data say, but what are folks in front of you saying to you? Are they actually saying, you know, we really need more fresh produce? Because that's actually more compelling than looking at data that says, you know, people don't eat enough fresh fruits because no one eats enough fresh fruits.
I'll say, just to chime in there, we use community-based participatory grant-making model. So we have committees similar to Rebecca's structure that they support the grant review process. This is the number one thing that we always have bigger conversations about when we're reviewing grants and thinking about funding something. Data is great. As Rebecca said, it is a nice add to a story, but if it is not centered around who you're serving, it is less likely that it's going to be funded. So if you're able to say, we've surveyed, we've had these conversations, we've had 25 people ask us for this, even if it's 10 people, the fact that you're listening to the people you're serving and that this is actually going to fill a need that they have clearly identified and articulated to you, that is the biggest win you could make in a grant proposal, at least from my perspective.
Yeah, and I think all this stuff too isn't just about the proposal. It's really about, you know, you've all designed programs. It's about designing a good program. I mean, that's what we care about more than like the proposal, I would say. So program design. So this is kind of the heart of the grant application, the heart of what you're doing. So pretty basic. Again, like who are you going to serve? Really specific. You know, we're going to serve 50 older adults over age 65 who speak Spanish. You know, really as specific as you can be given your program. You know, and all programs are different. There's some sort of long-term kind of transformational change work that I think is a little bit different than what I'm going through here, but this is really like if you have a program. What will you do? Again, you know, really specific. We're going to hold 5 workshops twice a week for 6 weeks at the senior center, and people are going to get there because we're going to pick them up, or whatever it is. And try to anticipate the questions that the reviewers might have about your program. And again, who are your key partners? That's always important if there are key partners. And if there aren't, you know, why aren't there? And not every grant needs partners, but just sort of be cognizant of that. Outcomes. This is everybody's favorite one. So really, I find folks who don't write grants a lot, this is an intimidating one. I will say it shouldn't be. I should have pointed out my picture, the Wizard of Oz pulling back the curtain. Specifically on this one, this really holds. So for us at least, you know, we're not a National Science Foundation grant. We're not a federal grant. We don't need, you know, a double-blind study to prove that there's causality. Really, we just want to know, like, what are you going to change? Like, what are you going to improve? How many people will that impact? You know, if there's a policy change, what will that be? And policy can be, you know, sort of the global policy, like you're going to change something at the state level, or it could be within an organization. You know, we're going to change our policy around, you know, how we have ASL interpreters for every event now. That's a policy that might get changed. Be realistic. So this is one, as a former grant writer, I know you always want to sort of like shoot for the stars and be like, yes, we are giving I appreciate the appreciate that. But what are you really going to do? And what you really might do in that situation is people may eat more fresh fruits and vegetables, and that you can measure by just asking them. And we know that if people eat more fresh fruits and vegetables, they're probably eating less processed food, therefore they're probably healthier. Like, we can make that jump. You don't need to measure it for us, because you can't. And then relate it back to the funder's priorities. So we're a health foundation. I've also read many, again, amazing grants, great programs, and all the outcomes are around education. And for us, we sort of look at that and say, well, this isn't really what we want to change in the community. We want to change health outcomes. A different funder wants to change education outcomes, so you should probably go to them for this program. So really think about and have that conversation with the foundation about what they're interested in really shifting in the community.
So I want to interject a question. Is money infinite? Is money infinite? Right. So if it's not your foundation, then there's another foundation, right? And so, so the other question. Say more.
Or long term, you know, a municipality is able to take on and say, you know, this fits into the line item in the budget. We've seen the proof model. We're able to scale it to the point where it's effective and efficient for the town or the city to take it on as a program and an initiative, and it becomes a line item in the budget. That is the long-term sustainable piece. So yes, it's infinite. It's just a matter of where it's coming from. I don't think one funder in particular may be infinite. It depends.
Like, what sells local government on funding something longer term for a community?
Yeah, I mean, honestly, part of it is their funding as well. I mean, we know, I think it was Robin or Carlene who mentioned, you know, 351 public health departments in the state. Funding public health departments to do some of this work. They don't have staff. They don't have funding. So I think it really depends. So if they have so I'll give you actually a great example, which is not in the healthy aging world, but when the drug-free community money came out, I don't know how long ago that was. It was before I was at the foundation, I think. The foundation had funded a whole bunch of work in our towns around substance use prevention with youth. So when that money came out from the federal government, they were actually in a great position to apply for those grants because they had the collaborations. They've been doing the work. And I think most of our communities, if not all of them, actually got that funding, which is a 10-year super sustainable grant. I mean, that is like the dream. But I think what foundations can do is really kind of help pilot things, help kind of, you know, prove that it works, or help people come together in different ways. And actually, I'll jump. We can talk about tracking success in a minute if we want to, but I'll come back to this. To sustainability. So I think that's really the question we're talking about here. And what I always say to folks, it's actually, this seems counterintuitive, it's not just replacing funding. Yes, that's the ideal. Clearly, if you can put a line item somewhere, if Robert Wood Johnson wants to come in and fund you, like, fantastic, do that, talk about it. You know, we have funded grants where it's like, next year, the school's gonna put this in the budget, we just need a stopgap. To me, those are like no-brainers for foundations. That's not usually what happens, especially in the nonprofit world. So, you know, think about how your partnerships can sustain it. Think about how you can actually sustain the work, if not the actual program. So if we fund a community health worker to enroll folks in health insurance and Medicaid for a 3-year grant, end of 3 years, you can't get that refunded. But that health worker has now trained 10 people in your agency to do that work. That's sustainability. It may not be that person, but it's sustainable. So I think you can always think a little more broadly when you're answering this question in grant applications. That makes sense? It didn't really answer your question, but.
you have a follow-up?
All right. All right, I'm gonna go back real quick. To measuring your outcomes, now let's talk about this real fast. I'm actually gonna jump to the last one. Again, be realistic. And talk to your program staff, especially if you're the grant writer, and your program participants. We've gotten grants where there's been this great data collection plan with pre and post surveys and this whole thing, and then we get the report back and the program director is like, wait, what? I can't do this. I didn't do a pre-survey. That's not something our folks are ever going to fill out. So just coordinate it. And again, we're not, at least our foundation, I think the community foundation, we're really looking for, have you just asked folks? Qualitative data can be really powerful. Have you counted numbers? Have you really just done the basics? Especially for smaller agencies, that's really what we're looking for. And municipalities, we know that you guys don't have the staff and the capacity to do huge evaluations. Equity. So this is a big one, and this one actually I probably should have led with because it should be a thread throughout all of it. And I put this first bullet here. I don't know, Caroline, if you have seen this, or Kara. I will say it's getting less in our grants, but we ask sort of like, what are the health disparities? Where's the health equity that you're working on? And a lot of times we would get the non-discrimination statement, like, we don't discriminate. Anyone can walk in our door. To which we say, I would hope so, because we actually won't fund you if you're discriminating. That's actually not what we're asking. That's just a baseline. I think there was one grant we didn't fund because of that, but that's so really it's about, are you actually understanding the disparities, especially around health, like I mentioned the diabetes example, and are you really talking to folks in the community? Have you actually asked the folks that you want to serve, what program they want? Have they helped you design it? Have they been part of this whole process? And I think if you can engage them and they're really part of the process in a real way, then you've answered the equity question in a really powerful way. Collaboration, and I think we talked about this, so I'll just go through this real quick. Again, what are other agencies going to contribute? If there's someone else in the community doing the work, make sure you talk to them. It, again, doesn't preclude you from also doing the work. It should not be a competition between older adults or homeless folks. That's crazy and awful. But just, know what's going on in the community.
I'll also just quickly add, if you're listing collaborators in a grant, make sure they know they're collaborating with you. That has also happened, and there is a real reality too. You might see them as a partner, but you don't want to say anything until you have the grant funding. That to us can sometimes be not a red flag, a yellow flag maybe, around the realities of, are you having long-term conversations? Is this partnership already there and strong enough to withstand the work that needs to happen between your two agencies? So that's just another thing. Make sure they know their name is going in your grant application, because, again, we know most of the players in a community foundations in general. They might be also talking to these other organizations. That other organization or institution or agency may also be putting in a grant application for their own initiative. So just make sure that those conversations are happening prior to hitting submit.
Yes, I will second that. I will say we've gotten letters of collaboration from folks that we know well that have been clearly like, they didn't really want to write it, and we've actually called them and said, like, are you really in on this program? And they've said no, and we've not funded the grant. So have the conversation. Because we know people. Talked about sustainability budget real quick. Budgets are all different, so I'm not going to go into detail. A few tips. Your line item should match your program design. So if you're, giving away fresh produce, the line item should be for fresh produce and for staff time and for space, and not computers. So just make sure it matches. And make sure that you're paying attention to what the funder will and will not fund. Again, it's all different. Some funders will not fund technology. Some will not fund overhead. We will fund overhead for nonprofits, but not for municipalities. So just sort of pay attention to that, because if half your budget is technology and they won't fund technology, you now have half the grant that you asked for. In-kind support. I think a lot of nonprofits in particular forget about this. Most of you, I'm guessing, have a ton of in-kind support into every program that you're working on, whether it's volunteers, whether it's space, whether it's food that someone's donated. Just talk about that, because it's all part of your budget and part of the support you're getting. and double check your math. At least one grant per round. We have people think the Excel spreadsheet adds up, but if you like change a line, then it doesn't. And if it added up to 30 and you meant for it to add up to 35, we're going to give you 30. So do the math. And I think that's it. Yes.
I'm happy to. I just wanted to go over a few more things. We're bouncing all over the place today, so thanks for bearing with us. A few other things to consider, just that I think after going through the specifics for an application and kind of structuring your request or thinking about the program you want funded, are other things to consider. So we had this conversation in planning conversations. You don't need a professional grant writer. For most foundations, that is an old school way of thinking. We do not need, as Rebecca said, the most eloquently written, perfect application from a grammar perspective. We are not going through it with a fine-tooth comb for that. What we're really trying to understand is the work you're doing and how you're going to do it, and how it supports our communities. So for us, it's leveraging your resources. So asking people, asking your network of volunteers or people in your world, does anyone know someone who can write grants or who'd be willing to try? Does anyone know a funder who can make a warm introduction instead of a cold introduction? Again, cold calls, we get them all the time, and we're happy to have a conversation. Many funders are moving in that direction, not all, so you won't find that everywhere. But if a warm introduction helps too. So I encourage you to leverage your networks there. The other thing is do your homework and have the conversation in advance. So our doors are open. We want to make sure you're putting your best foot forward and not spending time and energy on something that it is just it is a time-consuming process. It's not, we try to make it as least burdensome as possible, but there is work involved in putting a grant application together and program design prior to that. So making sure that alignment is there and that partnership could be there is a really key piece of it. For those who work for town agencies, I know there are a few in here, leveraging your friends of groups for organizations that only fund 501c3s. So some grant programs we run, some initiatives we run, we will support town agencies and municipal agencies. Some we cannot. So we leverage and we encourage if someone comes to us with a great idea saying, what's your relationship like with your friends of group? Or is there a nonprofit who's doing similar work that you already partner with that would be willing to write the grant in partnership with you and being the steward of those funds? So just thinking creatively from that angle. I'll also mention just finding ways to collaborate. Again, that's been a big strand to this whole conversation, collaborate and replicate models. So you do not need to come up with the fanciest, newest model of a program to implement, but there's great programs out there. Talk to another agency or organizations that's doing the work. Ask them. I'm sure they'd be willing to share some of their program design, some of their successes, some of the roadblocks. Don't reinvent the wheel. Replicate as often as you can and share that with funders that you've done your homework. That is a really, again, talk about sustainability. The fact that you're going to run into less roadblocks than, organization A or municipality A because you're learning from them is a huge asset. And then, again, using data to tell your story and frame your project, and then data about your communities, but data from your communities. So make sure you're listening and sharing that with funders as well.
Great. So any other questions before we move to another section of the workshop? Seems like you've been asking it as you go along, which is great. So what we're going to do now is take a little bit of a break from listening to our great two speakers, our experts on this, and give you a chance to talk to each other. And since it's such a small group, I was going to suggest maybe groups of 3 where you get together and you do something very simple. You talk about something that you want to get funding for and talk about what are your hurdles, not your roadblocks, not your problems, but what are your hurdles in order to be able to get the funding for that specific thing. So tell your story in your triads or dyads, however you choose. It's a small group. You decide if you want to be with 2 people or with 1 person. I could suggest, you're all kind of sitting in groups of 3, or you could do dyads. We're going to do that for about 15 minutes and see how it feels. and then come back. And then if you want to, you can share one story from the group or 2 stories, depending on what you feel compelled to do, what feels right. Okay? So let's take a quick look around the room and see who you want to join up with. I know if you're close to somebody, just pull up a chair. You're going to talk about your story and what you want to get funded.
Maybe 30.
So this meant that somebody's going to get up. And
okay, we're gonna form a little get together, and after you are done here, you can start your conversations up again, because there's just a lot of food to be eaten before we leave, and there's fewer of us. So there's snacks galore. We always end up with too much food, so please help us around that. So let's just come back together and say, was this useful? Was this useful? Do you feel a little more encouraged? So one thing that you're going to get after this is not only the video. I know James is mad at me because I'm not using the microphone, but you can hear me fine. But so one thing you'll get is the recording that James is responsible for, and you'll also get the slides. You'll also get a set of slides that I'm mostly not going to go through, but they're from another presentation that Patty and James did at the NCOA conference, and it's full of great information about other funding sources in the state, and then our AARP resources, of which hopefully you've availed yourself at the table, right? And we have unending copies of those. So it is an infinite amount of publications that you can get with us, okay? And so in addition to that, you'll be able to go through what I'm not going to talk about in the remaining time. So you'll Google these galore, or whatever search engine you use, and you'll be able to put this on your calendar to make sure that you make the deadlines, or at least talk to the foundations beforehand. AARP has the Community Challenge grants that come out every year, and we give out anywhere from $500 to $15,000, sometimes $20,000. Depends on the project and the need and the value of it. It's a national Community Challenge grants program. So we give out around $1.5 million across the country, which is really not a lot. We're among the smaller funders, but we at least give you something to start with, and you can pilot some projects that then you can get institutionalized. So again, you're going to just Google these, search galore, and you'll get these. I think Antron's going to send these out by Monday or Tuesday. So just keep an eye on your inbox for all this richness here. And I want to just give both our speakers some closing opportunities. So what do you want to say in closing? Like what's the thing you want them to remember when they leave here?
Oh gosh. Go for it. I would say have conversations. Have conversations with everyone. Have conversations with your funders. Have them with
you'll see in my presentation there's a variety of resources as well. So trainings and workshops, organizations who do that work, learn how to write a grant application, learn how to tell your story. But you know, that's really the key, is like be convicted of the importance of your work yourself, and how do you share that with others to make it go further. So.
Yeah, and I did ask the question, is money infinite, right? And so I want to ask each of you, do you get more applications than you can fund?
Yes.
You get more applications than you can fund, but how many do you not fund?
So it depends on, we run a variety of different grant programs. It really depends per program, but I would say on average we're funding anywhere between, for some of them it's like 17% of the applications submitted. For some of them it's 40 to 50%. We have one program that we fund everybody who applies, because we know that it requires the entire network of organizations that are requesting funds to make that work successful. So it really sort of depends. And again, those are great questions to ask a funder prior to applying as well.
I will say, you know, we have a letter of intent process. So of the ones that get through the letter of intent, so that's really a conversation with myself or our program officer about, is this really a fit? fund the vast majority. It depends on the grant round. And I think we have the luxury, we have an endowment. So unlike Caroline, we don't have to fundraise. So there's not unlimited money, obviously, but what we tell and we only have 25 communities. So what we tell our grant reviewers, which are community members, is fund the good programs, and we'll figure out the math behind the scenes. So if you write a good grant, it fits, we'll fund it.